Christmas time means running around and trying to keep up with the family. Fox 23's Andrew Carter shows you a doctor performing a procedure to help those struggling to move and has people from around the country coming right here to Green Country to get help.
An orthopedic stem cell procedure once seen just for athletes and done overseas is now helping everyday people from around the country, and it's happening right here in Tulsa.
They pulled my own cells out of my hip and injected them in my knee.
A knee is one of the most common joints that we treat.
And Dr. Venkatesh Movva in Tulsa is treating patients from around the country right here in Green Country.
I've only been in here for 6 months, and I was on a cane when I come here, and I'm getting along real well.
More pressure right now.
What Dr. Movva does is find patients or candidates with mild to medium arthritis or wear and tear in their joints or meniscus and performs the Regenix procedure, which he says is a great alternative and more effective than surgery or a full knee replacement. Now, the knee procedure requires extracting bone marrow, usually from a patient's hip. Then the stem cell is processed in a lab before a patient comes back, and that same stem cell is injected into areas of tear where it's aided by blood cells to boost recovery and growth.
And after that, we slowly ease them back into their activities. After that first week, they're kind of getting back into their activities. Within 2-3 weeks, they're doing whatever they want to do. High-level athletic activities we may hold them like an extra week or so.
Aaron Puddin from Kansas says he was in a tractor accident when he was 40 years old. He says by 49, the injuries lingered, and finally, over a year and a half ago, his knee went out.
I couldn't get around worth a darn. And they said I was going to have to get it replaced, but they didn't want to yet because I was too young.
This has been proven to be the safest. Obviously, you're just putting your own stuff back into you, so there is no risk factor other than just a regular injection if anybody gets it.
Puddin says it works.
Oh, heavens, yes. Yeah. Tremendous.
Now he's walking around just fine. His wife even told me she's glad he can dance again. He says the idea is good enough.
Well, I can't really dance anyway, but I can get out there now and not fall down or whatever.
Dr. Movva says this specific procedure is just over a year old and says the data backs up the testimony.
We drive our treatment modalities basing on the data that we've been getting.
That data has Movva wishing for a time machine.
I tell my staff, I wish I'm younger. I mean, you're just seeing the beginning of this. This is going to be the future of medicine.
Andrew Carter, Fox 23 News.
Dr. Movva added that patients will see improvements following the procedure for many months. If you're wondering about cost, it's anywhere from $4,000 to $7,000. That's actually a pretty cool procedure. I mean,
yeah.
You can have a quick recovery time.
Exactly, especially if you can make sure you can help all those people. Well, we have rain tonight. It will clear.